Homes RI is a coalition of organizations working to ensure that everyone has a safe, healthy, and affordable home. Hopefully, these interviews will bring insights to the need and work and highlight where housing intersects with other issues and opportunities.
My name is Anthony Faccenda. I'm the program supervisor at AIDS Project Rhode Island. We provide an array of support services for people living with HIV in the state of Rhode Island, and as well as prevention services. And in my role, I oversee the housing navigation program, and I also oversee the testing program.
What does home mean to you? Like when you hear the word home, like what sort of images does that conjure?
I guess I kind of think of two things. First, like a physical structure, like having a roof over your head, somewhere to lay your head at night. But I also think of kind of the feeling that it conjures up. So me, mainly think of feelings of safety, security, stability.
What are the challenges that people affected by HIV face in terms of housing security and remaining in their home?
In terms of like obtaining housing, I think just the limited availability of affordable housing in Rhode Island is a huge challenge. So there are subsidized housing options for our clients, but they, have a lot of multi-year waiting lists, which isn't as helpful if, someone's housing unstable or they're homeless. I kind of think of it as a supply and demand issue. There's a huge demand for housing and not, enough housing to supply the demand. Also, like in addition to not having enough affordable housing, some of our clients have other barriers. So some people, living with HIV, many of our clients, they've been evicted from public housing, which precludes them from getting into public housing again. Some of them have criminal records, which creates a barrier. Also, a lot of them are fixed incomes. So they either receive SSI or SSDI. So market rate private housing isn't always, a viable option for them. And then that also goes into the problem of maintaining housing once they get it, because if they do have a limited income and they happen to live in private market apartments, there's no control. So we have a lot of clients that when landlords raise the rent on them annually. So if they do have fixed income, which that was once affordable is no longer affordable for them. They say ideally you should pay like 30% of your income towards your rent. We have a lot of clients that pay 50, 60, 70, even 80% of their income towards their rent. So it really leaves them not a lot of money for other necessities.
What sort of services do you all provide for somebody that's like seeking housing?
Yep. So we don't have physical housing. So what I do is I serve as a housing navigator. So when I get a new client, they're primarily referred by the case managers. We have a big case management team. And we serve like over 200 people with all of our different services for people living with HIV. So I'll get a referral. I do a housing assessment, determine what their housing goals are. I always let the client lead that discussion. I don't like to, I make recommendations, but never tell someone what kind of housing they should live in or what they should do. So that'll the client, based on what they tell me, we explore their options. So for my clients, affordable housing is a necessity because of their income. So it's going to be a lot of applying for housing lists, for Section 8 vouchers, base vouchers, things like that. And then once they do obtain housing, we can help them with rental assistance, which is really helpful. So I can pay someone's first month's rent or their security. And we can also use rental assistance to keep them stably. If they do fall behind on rent, we can help them pay back rent, also help them pay utilities. So we do that. And also we have a food program, so we can give people food every week. We have a pantry, which has been closed since the pandemic, but we are delivering groceries to people every week, and that helps supplement their costs so they can put that money towards housing as well.
It's hard to communicate the way it's that housing is like part of like a system where like your food and your job are all playing, like they're all playing counterpoint with each other.
Like many people out there, our clients are the ones that do live in market rate apartments. They're a paycheck away from losing, their housing. Pandemic's been very stressful on people. But, the general public, but particularly people with HIV. So luckily we do have these support services for them where we can try to help stabilize them, as best that we can.
Yeah. So for people who are not able to secure housing, how does homelessness affect positivity rates?
Yeah, so homelessness and HIV are very interconnected. So if someone is HIV positive and they're homeless, they're going to generally have much poorer health outcomes. So they're not going to be generally linked to medical care. It's both preventative care and HIV care. They're going to be less likely to take their medications, which is very detrimental, obviously, to their health. And also for someone that's newly diagnosed, they're going to be less likely to engage in care, even to initiate care. So there's people out there that are homeless that don't know that they're HIV positive, for example, because they're not getting tested for HIV. So yeah, housing is, a social determinant of health. It's a predictor of positive health outcomes. It's especially true for people with HIV. So if they are homeless, they might be more concerned about, where am I sleeping tonight? Am I going to have food tonight, or whatever it is? So they might not be like thinking about their HIV care. That might not be a priority because they're more concerned about their basic needs.
You had mentioned people who like are experiencing a bunch of barriers and might not know their status. What are the testing services that are available?
Yep. So, COVID has kind of impacted that, at least in Rhode Island. So prior to the pandemic, we were offering testing services at our office 4 days a week. We had to stop in-person services back in March. So, it's been pretty difficult in that regard. So what we ended up doing was, we saw that there was still a big demand for testing. People were calling us all the time. So we started an at-home testing program back in June. So since June, we've mailed out about 80 tests to people throughout the state. There is an option on there too. If you are homeless and you don't have a mailing address, we can deliver it to wherever they are, or they can come pick it up. So that's been really huge. We've received really good feedback from clients. So a lot of people are kind of, in these uncertain times, they might be scared to go to their doctor, to a health clinic, or to get tested. So we mail the test kit to their house free of charge, and we do counseling over the phone. We can either do it over the phone or via Zoom. I've done counseling via text message with people and email. So we make ourselves very available. If someone wants other type of testing, so maybe they want to get tested for other STIs, which we don't do, we work with our community partners. So we work with Open Door Health, the Miriam Hospital, and we can help people make appointments to get more comprehensive testing. Also AIDS Care Ocean State, they're another AIDS organization in the state. As far as I know, they're still doing in-person testing. And we've attempted a couple times to restart in-person testing, but then new cases keep flaring up. So that's kind of been delaying us. So as we're following the governor's orders, I know things are going on a pause pretty soon. So once perhaps new cases start to go down, we will offer in-person testing again. But as of right now, it's just the testing by mail program.
And that's a swab?
Yep. Yeah, exactly. So it's a rapid test, and it's an oral swab test. So basically swab your gum line, takes 2 seconds, and then you get your results in 20 minutes. So we do have a lot of people that don't want, over the phone counseling, but they might call us after the fact just to talk with us. We provide follow-up care too. And since June, we were able to identify 2 HIV positive cases, which is a very high positivity rate, like 2 out of 80. To give you an idea, we did like 1,000 tests last year and had 1 positive. That's with in-person testing, so 2 is pretty huge. And even though, it's remote, we were still able to link both people to care. So they both got confirmatory testing. both got linked to HIV care, and now they're both taking their HIV medication. So, you know, it just goes to show how important testing is.
I did a miracle like right out of school, and I worked at like an HIV testing clinic for like my first year out of college. So
What state?
like, I was in New Mexico. I was in Santa Fe.
Mm-hmm.
I was also doing some work in Albuquerque. I mean, they're like right next to each other, but yeah, like when you're talking about doing the counseling and stuff, like I've done so many of those like interviews where you're just like asking people about their sex lives.
Yeah. Yeah, I'm finding that it's even more complicated doing it remotely. Usually,
Yeah,
if someone's in person, yeah, I can make eye contact with them, and there's some level of trust, like they've come into the office. But some people, they don't want to talk on the phone; they only want to text. And texting counseling is extremely difficult to
yeah,
me. Like texting in general, stuff gets lost in translation.
yeah, for sure.
But texting sexual health stuff can be very complicated. But yeah, we're trying to make it work.
So you are doing texting as well?
Yeah, so what we do is if someone wants to request a test, they go to our website and they fill out a form, and probably just takes about 2 to 3 minutes. So it does do like a sexual risk assessment on there. So I don't necessarily need to ask those questions. So I'm asking a lot of questions via the form up front. The client will fill it out, and then there's an option on there saying what's your preferred mode of communication. So it's either email, text, or phone call. Most people say text. So I'll text them initially, just let them know we received the form, and then tell them a little bit about the test. And then, you know, do you have any questions? Sometimes people have a lot of questions, and we're just texting back and forth. And I'm always like, I'm free to talk on the phone. That might be easier. And they usually just want to text.
Yeah.
So it kind of, sometimes, I mean, it's more difficult, I think. But what I think is it's really important, because a lot of those people, they're indicating on the form. I ask a question, would you do at-home testing if in-person testing was available? A lot of people are saying yes, they actually prefer to just stay at home and do testing. So
Oh, wow.
these people, including the 2 people that tested positive, there's a high likelihood that they may have never come in for in-person testing. They only wanted at home. So we're able to work with a different population that we weren't reaching otherwise. So.
Yeah, it's really interesting the way that COVID is allowing us to like rethink our design systems, and the ways that is like inviting new populations to participate, especially like if somebody has like a mobility barrier, like just seeing people trying to participate in like advocacy work where we might have had an in-person event at the State House, but now it's on Zoom. And so that like opens up opportunities where maybe you couldn't drive across the state to get to the State House, but you can log in for an hour on Zoom.
Yeah, like at first, a lot of our clients were, I mean, the younger people requesting tests, they're fine with, you know, texting and emailing and Zoom or anything like that. But a lot of our clients are really, I think it's like 80% of our clients are like 50 plus. So the people that are HIV positive tend to be much older from our clientele. So they were a little resistant at first to the idea of telehealth and telemedicine.
Yeah.
But now they're really fast learners, and a lot of them become very acclimated. So they're doing Zoom calls with us or Google Duo calls, they're texting. So it's really like a, you know, try fire kind of thing. They're really all comfortable with it now out of necessity. But I'm interested to see what happens when we are able to have in-person services again and things get back to normal, to see how like pervasive telehealth will continue to be. I think it's been very important, and some people actually prefer it.
Yeah, definitely. And I think like it really, on the subject of housing, it really highlights how like your home has become an HIV testing clinic. You know, it's like, it's serving all these like purposes that it didn't serve before, or it was, but we weren't like so aware of it.
Yeah, that's been like a strange adjustment too. Like because I think a lot of people thought, I can't do this from home, I can't work from home. And then you see you can do almost everything from home. So
Yeah,
it's strange. I do miss being in the office, but there's quite a bit I can do at home. For housing, it's been a little strange because I'm used to sitting in person with clients,
Mhm.
actually writing and filling out housing applications. So that's been like a little trickier. I can do it over the phone, but I miss the in-person interaction with people. And then
Yeah.
for like example, the Rhode Island housing centralized waiting list, I can do that over the computer with someone, like actually type into it. So some things are a little bit easier, but
Mhm.
things that I have to write out and constantly ask people questions over the phone, it's a little bit tougher. It takes me a little bit longer to do the application, but I'm finding that people actually appreciate the services a lot more because they know that you're at home and you're, it's more difficult because I'll have to go to the office to print something or, kind of drive back and forth. So the clients are a lot more appreciative of when I do something simple, like help them apply for housing or give them some resources.
Yeah.
So I think that's been interesting.
Are there other organizations that you think are doing really great work in terms of like helping connect people with HIV and housing resources, or who are being really strong advocates for housing? They don't have to be like partners in state, but maybe there's an organization in some other place that has a really good model.
Primarily familiar with like our local resources, but I
Yeah.
would like to highlight the other, I did highlight most of our services, but
Yeah.
there are other AIDS organizations in the state that are doing great work with housing. And because they are partners of ours, like all three agencies do advocate for affordable housing for people with HIV, and increased services. So I mentioned AIDS Care Ocean State a moment ago. They are the largest supplier of HIV housing in the state, so they're hugely important. They
When you
also,
say they're supplier of housing, they manage properties.
yes.
Okay.
So, like I said, we don't. So I just do housing navigation. They actually have housing. So I refer a lot of clients there. I help clients apply for their housing. And they have like a wide variety of housing, which is really important for people with HIV because not everyone can maintain their own independent apartment in the community and be successful. So they do have those options, but they also have transitional housing options, supportive housing options, supportive housing for people with substance use issues. So they kind of run the gamut of all different types of housing that basically suits the needs of many clients. They also have an assisted living facility, which is important for a lot of older adults aging with HIV who may have, certain comorbidities. And there's also Agape. They're the third AIDS organization in the state. They're a program of Community Care Alliance. And they, in Providence, they have a transitional housing unit for men with HIV. I think it's like 12 to 14 beds. Transitional housing for someone with HIV, also with a co-occurring issue. It could be someone with a mental health issue or someone with a substance use issue. So there is obviously, like I said earlier, a lack of affordable housing in the state as a whole, but there are some good options for people living with HIV in the state.
What's one step that either like the government could take or like Rhode Islanders in general could take that you think would have a big impact?
I think money and funding is the biggest thing that we need. So my criticism of Rhode Island was always not having a permanent funding stream for affordable housing. But I know with the fiscal year 2021 budget, the governor did put money in there for affordable housing. I know everything's up in the air right now due to COVID and lawmakers are making changes to the budget, but investing in housing is hugely important. To me, it's kind of a no-brainer because whether it's federal funding or state funding, we know that housing is going to equal better health outcomes for everyone, right? It's going to lead to lower healthcare costs. It brings down could bring down low crime rates, decrease costs for incarceration. Like it's gonna save money and save lives in the long run. So it's very important. And then in that same vein, while I'm asking the government for money, I think they should also invest in funding for HIV. So like in Massachusetts, they allocate around like $30 million a year for HIV support services in their budget. Rhode Island doesn't do that. So I think it's really important that Rhode Island kind of take a stand and just show that it's very critical to invest in support services for people living with HIV by actually allocating money in the budget permanently every year, because our programs are always subject to budget cuts. So we primarily receive federal funding, and then we have some different grants here and there, but those grants are limited. It could be 1 or 2 year grants, always subject to cuts. So, and those cuts, impact our clients. That could cost someone their housing or what have you. So it's really critical that the government really invests in housing with permanent funding streams for people with HIV.
So if somebody was watching this and wanted to get involved, like maybe like to volunteer or to, I don't know, get involved in some other way, like as an advocate or something, like what opportunities are available for that?
Mm-hmm. So prior to the pandemic, we did have like a small roster of volunteers at our office. Because our office is closed, in-person volunteer opportunities are obviously very limited. So I've just been encouraging people to follow us on social media. We're on Facebook, Twitter, and Instagram. Go to our website to look for updates. Once things start to hopefully return to normal, whenever that is, we will have more in-person opportunities for people to get involved. We do have an interesting event coming up, though, in honor of World AIDS Day. We're going to have an art show. So it's going to be, I think we have up to like 40 pieces so far. It's all client-created artwork, and it's going to be for sale at our website. So aidsprojectri.org/art, and that link will go up on World AIDS Day, December 1st. We're also going to have several window displays throughout the city. So the Providence Public Library, Trinity Rep, the Providence G, and Project Weber Renew. They're all going to have client artwork, and then also quilt panels from the AIDS quilt. So we're really excited about that. Obviously, this initially was intended to be an in-person art show, so we kind of had to adjust everything due to COVID, but we're really happy with how it turned out. The clients created a lot of great artwork that they're really excited to exhibit. Also with APRI, we do the annual AIDS Walk and Run for Life every year. That had to be changed to virtual this year. We did that back in October. So we did have a bunch of awesome events lined up for this year. This year was our 35th anniversary. So we kind of had to modify everything to include a virtual component. But yeah, that's kind of where we're at right now.
Is there anything else that we missed that you feel like would be great to highlight? Any other tangents you want to follow?
Yeah, I'd like to highlight the role of the clients and people living with HIV.
Yeah.
So, I spoke to how important the AIDS service organizations are in the state, the three that I talked about, but the clients themselves are really important. So they're their best advocates, right? Like I can advocate for clients all I want, but their voices are what matter the most. So when we're talking about requesting increased government funding or anything like that, the clients are always their best advocates.
Thank you so much for chatting.
Yeah, no
I
problem.
won't take any more of your time. Yeah, thank you so much. I'll be in touch.
All right, cool.
Yeah.
For more information or to get involved, visit homesri.org.